Welcome everyone. So my name is Piotr Żołka. I'm the WHO team member. So hello, and maybe let's start the presentation. Frederick, could you add some words of the opening this session?
Yes, good evening. I'm Frederick. I'm from the V4 Social Good Board. Welcome everyone. So I guess today's session is really your time. So that's open for any volunteers to ask any questions. So there's no set agenda. So I think that's really an opportunity for anyone to ask questions. Piotr has been answering some questions on Slack, but you might have a lot more questions or maybe ask us for some feedback. So I guess the floor is yours.
Yeah.
Hello,
yeah. Thank you. Good afternoon and good evening. The session is recorded, so afterwards we just posted this on the YouTube channel and then we repost on the Slack. We prepare a little bit question that is repeating over and over, so we will go through that. In the Zoom, you having a possibility to ask the question. So there is a Q&A session. Approximately after 10 minutes, we go with a Q&A. Of course, you can raise the hand and we can try to answer your question. Okay, so let's share the presentation. So again, hello on the Q&A session related to Accessible Data Visualization Challenge. A little bit repetition, we are WHO team. So with me today, there is Dorothy Lenor, the Business Intelligence Lead, Kalian Kamenov, Technical Officer, Disability, and me, Piotr Żołka, Accessibility Consultant and UX Strategist. Also, part of our team member is the Celine Hasbun, Head of the Frontier Technology and Data. As a little bit repetition about the World Health Organization, we're celebrating the 75th anniversary, and our organization is the main purpose of our organization is to promote the health and the well-being of the people around the globe. We promote the health, we keeping the world safe, and we addressing the health emergency. With that, of course, if you want to watch the previous recording, there is already a link on the Slack channel, also on the page. You can also grab the recording through the QR code, and you can watch the recording on your mobile devices. So we are very encouraged to this, and we want to really apologize for the last session that we haven't had a possibility to invite all people that are willing to join our session. So sorry for that, and welcome on the Q&A session. So I hand over to my colleague, Kameleon, to discuss the first question related to the topic. So what I did, I tried to collect the most common question, and there is a few updates for the file. We haven't changed any data, so it will not influence your current analysis, but might help you to understand better the data. So the floor is yours. Could you a little bit tell what is news that we added recently to the file? Everything that is sharing currently is already stored in the original file in the Google Drive. So you can go there and you can consume and use it.
Thanks, thanks, Piotr, and hi everyone. So I couldn't join, unfortunately, the previous webinar, but my colleague Francesca presented a little bit on the data. I am part of the disability team at WHO, and we have this data. We use this data for a global report on disability that we published some months ago. And perhaps in the beginning, I have to a certain extent apologize, because when we shared the data initially, and I guess based on the questions that you had, it was made clear that we had to provide a bit more of information just to facilitate your usage of the data. But we have tried now to do that by adding some information in the addendum that will help you and help answer your questions, but also facilitate your progress and work in the next weeks. So the first thing is basically the fact that the different spreadsheets in the file, so the one on the regions, the one on with data on the income groups, and the one on age, should basically be seen as three separate data sets, because for the regions, for example, we present data on the 6 WHO regions, and for each of these regions, we have included data only on the countries that are included in each of these regions. So WHO has 194 member states, and the data presented there is only for those 194 countries. The spreadsheet with the income data is based on all the countries that are members of the World Bank income groups, which are, if I'm not mistaken, 189, which means that there is a slight difference with some countries that may be WHO members but are not World Bank members. And the little changes that you might have should be because of the difference in the countries that are included. Now the H1 is basically because it is for global data, so it's not by income or regions. It includes all the countries that we have data for, which may be more territories or countries that are members of WHO or the World Bank. And in fact, the IHME, the Institute for Health Metrics and Evaluation, that collects all this data, they have data for 204, which is like 10 more than WHO. And that's why you see slight variances and differences between the three files. So if you do any sort of cross analysis between the different files, just consider the fact that they should be really seen as three separate independent sets. So we have included this information now in the addendum. If you go to the next slide, there is also addendum about the reference levels, because I think some of your questions were related to the fact that if you combine, for example, all the level 3 causes for disability, they don't correspond to when you add, the sum of level 2 or level 1, which is like the total. And again, we omitted this, and we should have mentioned this from the very beginning, that actually level 3 data is basically data that shows all the individual health conditions or impairments that lead to disability. So this may be, for example, low back pain or schizophrenia or any other condition. And they are presented individually. In level 2, what we do is to combine them into higher level groups of conditions. For example, low back pain or other conditions that are related to the musculoskeletal system of a person. All these fall within musculoskeletal conditions. Schizophrenia, depression, or other conditions that are related to mental health are grouped into mental health. However, when we group them, we only count people once. So if someone has, for example, 2 conditions like schizophrenia and depression, they're not counted twice, it's just counted once. So we adjust for what we call comorbidity. And that's why the number in level 2 may be a bit different compared to level 3, where, we have basically, if one person has a depression, we count this person in depression. If this person has a schizophrenia, it might be counted also in the number of those who have schizophrenia. And then similarly, for level 1, we also adjust for comorbidity, meaning that then when we group everyone, even those people who may have more than one condition across various groups, like someone has a low back pain and has depression and has, I don't know, for example, diabetes, they're only counted once. So basically, all this long explanation is to say that the 3 levels that the data is grouped in present basically different categories. So the sum of each of these will not be equal, just because there is an adjustment for comorbidity. Next slide, maybe. Yeah, in the addendum for cause, we have basically added, because I think it was also coming from a couple of you who left comments in the Slack. So in the addendum, we have created like a table where we show all the causes per level. So for example, you see skin and subcutaneous diseases 2, neoplasms 2. So you see the cause name and then the level to which it corresponds. And then on the next slide, you will see that we also have added in the reference cause groups a description of the groupings and the hierarchy of the causes by level. So for example, malaria is level 3. It corresponds to the group of neglected tropical diseases in malaria. And of course, in level 1, these are all grouped together. So this may be helpful for you to see. And I'm not sure if we had it on the slide, but because I saw that there was a question about injuries, just to explain that injuries is a bit different thing, in the sense that it doesn't really correspond to the health condition. So we have put it in level 3, but it hasn't been grouped in level 2 as such, because it's already like a group itself. So we have put it in level 3, and you can use it as like an individual condition, even though within injuries there is more information, more types of injuries. We have put it in level 3, but it doesn't correspond to anything in level 2, just because it's already a group. I hope that it's clear. I don't think that this will cause any issues in what you are doing. I mean, as analysis or figures, but just so you know that it doesn't correspond to anything in level 2. It's a different sort of a group. The only one that is really different. All the rest correspond to a specific group in level 2. The next slide, please. Should I take these ones, or it's you, Piotr, that will go through them?
Yeah, thank you. Thank you for answering the question. Maybe I will go through the general question that appears in the Slack. Also in the Q&A, we're having already a few questions, so we will answer them during this session. So that was a question related, should we use the WHO branding? Definitely, we not recommend to use it. You can use the your own branding, or you can use the visual, so the host of the event, and you can put the logo there. So definitely we don't recommend to use the WHO branding. The next question, that was a question related how the data was collected. So we put a little bit explanation. The data came from the Global Burden of Disease study. Of course, if you are interested in the more, we direct you to the healthdata.org page, where you can read a little bit more about those information. The next question is, maybe I will read it, please. I want to understand better what the both category in the sex ID column represent. Does it represent a special class, or I can filter the column to just the male or the female categories? So there is a quite good question, because it's really ultimate depends on your data and the question that you have in your research. So you can show either the both category, or you can divide that between the male and the female, or the both. It's really this is your decision how you want to present those data on the dashboard. Okay, the next question was a little bit, I'm very interested in the participating in the WHO event. However, I wanted to check if I can participate in the team of free or only individual. So it's up to you. So you can work as the one person. Of course, I know that the people are coming and they're joining for the WHO event, and you can even ask somebody directly on the Slack, maybe somebody looking team, because working together is always better than working alone. Or if you prefer to work alone, you have this possibility. The next question that is, that was a question: are we allowed to host the data somewhere? Yes, you can host this dashboard on the public-facing website, but please that the data is sourced from the WHO and from the visualization from Social Good project. Is very important. So if this website will be public, it's worth to mention from where the data are coming and why you build this dashboard. And because we having a few questions, also we added the addendum to the Excel file. We want to also notify you that we're giving you a little bit more time for the submission. So the new deadline for submission is the 24th May. And we also giving us a little bit more time to evaluate the submission. So the final presentation will be on the 6th June 2023. Maybe a little bit of repetition before we go to the Q&A session, and we will leave the floor for the people who joined the session. Remember that around the globe there is more than 1 billion people, which is 16% of the world population, who have a significant disability. And we need to ensure that we building the better accessible future today. Remember, for those people who participate the first time, all participants who sent the submission, you have a chance to receive the badge, the Accessible Data Visualization Champion, that you can share it on the social media, and to be proud to use a new skill for your future project. So thank you. That was first finish of the first part, official part of the Q&A, and now I am stopping the sharing presentation, and maybe we can go to the Q&A, or maybe somebody can raise their hand if have anything to ask directly our dear guest. So that was one question. Should we prioritize any of the data, even potentially not included data points? And the Kylo colleague is already. Kylo, maybe you can respond on this question if you want.
Yeah, sure. Thank you, Piotr. So what I answer basically is that, this is a data set, and then it depends really on the person to decide what they want to emphasize, what they want to put a focus on. I think it's important that what you show tells a story, and the impact of the data is visualized on the graphs, but it's really up to you to decide what you want to prioritize in the data and show.
Okay, thank you. I wish that this answer, and this is what we're telling you, need to find out the research question that you want to answer, and maybe you can focus on the one table or maybe the two table. It's really up to you. So thank you for this question. Let's go for the farther. So the data, so the next question, the data is divided into WHO region. Since they differ from the usual geographic division, could you explain the reason behind it? Additionally, what is the difference between the region and location ID in the region tab? Each region has only one value for location ID.
Yeah, should I answer?
Yeah, please.
Yeah, so WHO has divided all the countries in the world into 6 regions, which are not the same as the continents, for example, geographically, and there are various reasons for that. This goes back to many decades ago when this decision has been taken. Normally, you have regions with certain characteristics of the countries that are more similar than the others. For example, the countries in Northern Africa, like Morocco, Algeria, we have grouped them with the Eastern Mediterranean countries, and they're not in the Africa, even though geographically they are part of the African region. So this is just, for different reasons, this is a grouping that exists for many decades. And normally in WHO documents, when we present data, we always present it by WHO regions and not by geographical regions. And I see that Dorothy maybe wants to add to that.
Dorothy, please.
Yes, so I want to focus on the last line of that question. Yes, region and location ID has a one-to-one correspondence. So basically it is the same. And region, the column region is just more readable, but maybe it can be made more readable. If you look at the ref location sheet, which would spell out the region acronym.
Okay, thank you for that. Okay, so I think this is already addressed. Thank you for this question. So let's jump to the next question, because I'm saying there is a quite bunch of them. Prevalence shows the number of the people in the world suffering from certain condition, provided that the condition cause significant, moderate, or severe disability. However, not all of those disabilities, regardless of the severity, cause significant problem with using understanding visualization. Does the data take that into account? So there is another question.
Yeah. Should I go?
Yeah, please, Callum.
Thank you. So just to say that the data is independent from any problems or difficulties that a person may have understanding visualizations or related to digital accessibility. This means that this data just shows the number of people with disability. Now, many of them may experience difficulties understanding visualizations. For example, those who have conditions related to intellectual disabilities, or for example, those who have vision impairment, or certain conditions that may lead to difficulties accessing and understanding visualizations. But the data is not really about this. So the data is just counting people with disabilities based on whatever health condition or impairment you may have underlying the disability. So the two are not connected, basically. However, it would be good, of course, and that's why I think we're doing this whole exercise, if you consider the variety of different challenges that different groups of persons with disabilities may have when they read and understand visualizations. So the more accessible, of course, the better it is to reach more people.
Yeah, thank you. And this is lovely. And remember that we need to build also in terms of the visualization, something that will be addressing almost all of us. There is a third question. According to the table, level 3 inquiries are part of the level 2. However, the data does not have a level 2 entry with the name. I think that question is already answered in the previous presentation, so it's a checked. And Dorothy, please, you have something to add?
Yeah, I actually thought that I put the same injuries in level 3 and level 2 because more or less, since it doesn't belong to any level 2 category, it is a level 2 in itself. So forgive me, maybe we can put that correction if that version didn't have it there, but it was intended that it shows us level 3, which is the original data, and then level 2 is also injuries itself. And
Okay.
why? Because there were no details and it wasn't grouped. So more or less, it is level 3 is the lowest level. And since it doesn't belong to any category 2 or level 2, then it belongs to itself in a way.
Gotcha. Okay, thank you for that. So we will make this little bit update on the file, and we will notify you on the Slack channel. And let's go to the fourth question. The data dictionary doesn't contain explanation for the income group country variable from the income tab. Can you explain the meaning of those values for this variable and/or provide income intervals for each value and list of the countries for each group? And then later there is a reference for the World Bank classification. Kyla, do you think that you can try to answer this question? Mm-hmm.
Yes, so the data in this spreadsheet is based on the World Bank, if I'm not mistaken, 2021 classification of countries to 4 groups, which are low income, lower middle, upper middle, and high income countries. So the 4 categories that you have are based on the classification of the World Bank. Now, the World Bank normally gives always an update on the income. So what are the variations in the income? And the groupings that you find in the data correspond to these ones. Now, I'm not sure what you mean by if we can you explain the meaning of the values for this variable, and I'll provide income intervals for each value. So income intervals, yeah, I mean, the ones that you have here, if this is the one based on the 2021, then these are the ones that we have used before. So you're right about that.
Yeah, Dorothy, do you want to add something? You're muted. You're muted.
Sorry, yeah, thank you. So maybe just to confirm, after this session, we will take a look at the exact version. Is it the July 1, 2021 or the July 1, 2020?
Yeah.
Because
Yes.
sometimes, when they collect it, it's based on the previous year's classification.
Yeah. I will
So,
confirm that, and we can.
So in other words, we will include that in the addendum for the Excel file if somebody looking for this information. And the last question, the age table use prevalence of the disability, and the income and the region table use mean prevalence of the disability average. Can you explain a bit more about this definition and any differences?
I think I checked that before it was posted. It was given to me right from you, Kaloyan, and I looked at how it was calculated. It looks like an average. Yeah,
it's an average. It's an average, and then you have the confidence intervals, the lower and the upper for that. So it's the average or the mean. It's the same thing.
Okay, unfortunately, I don't know who put this question because it's anonymous, but it seems that we answered all questions that are at least listed in the Q&A session. Perhaps you have some additional question. You can raise your hand, or you can still post this in the Q&A session. We can wait. If somebody want to ask the question, please free. Okay, so there is the last question. May I confirm the average refers to the prevalence from the different countries? There's a question from Harris.
So you mean, for example, if you talk about the region or the global, if this is what you mean, yes, this is the the average from the different countries, for example, in one region or in one income group or globally?
Okay, Harris, I wish that we answered this question and you're feeling more comfortable to use the data. Okay, so this is the end of the session. So thank you very much for the attendees. The recording will be available pretty soon. You can, of course, go to the Google Drive and you can check the addendum. There is additional information that we mentioned on the beginning. And if you have still some thoughts, please post us on the Slack so we can try to help. Frederick, do you want to add some last words for the session?
No, just maybe before close, thank you very much. You're very impressive, answering all those questions. There's a lot of questions, it's complicated data, especially for people that don't work in healthcare. So thanks for your patience and then for providing so much context and information to the volunteers. And I'm glad we're extending the project, so there's even more time now. So yeah, for people recording, watching the recording at home, ask questions. There's never any stupid question. So there's no shame asking question. If you want to share your work and ask for feedback as well in the Slack, as a screenshot, for example, people will be willing to give you some feedback as well. Thanks to the team.
Thank you very much. Have a nice day, afternoon, evening, and take care. Bye-bye.
Thank you. Bye.
Yeah, thanks, sir. Bye.